In the UK, there are 3.5 million people felt to be living with a rare disease, and in Northern Ireland, 110,000 people living with rare diseases, adult and children. Metabolic is a very new specialty, and what metabolic medicine does, it deals with chemical reactions in the body, and it's where you may be short an enzyme, a protein transporter, or where a complex chemical process in the body goes wrong. The problem with diagnosing a rare disease is the fact that a lot of people won't have met these conditions along the way, and people will always think of common things first, and you have to think of the rare diseases. And many of our patients will say that they've gone on a diagnostic odyssey in which they have seen their GP, they'll have gone to the local paediatrician, they will have seen numerous specialties, gone through huge amount of investigations, which could be imaging, genetic tests, lumbar punctures where you're taking blood fluid from their backs, and really there isn't a diagnosis. And this is why the important thing is that you get centralised care and they meet the specialist and that we all work together. Sometimes parents can say the diagnostic odyssey can be 5 to 7 years. Most children will have other normal conditions, and that's the thing, is trying to work out what the difference, what the red flags are. And this is why educating our other colleagues is so important. Any patient, when they have a sick child, wants to know an answer. And the important thing is that, first of all, they know that you're really trying to find an answer. So we will involve whatever testing, genetic, and sometimes the science isn't there yet. But if you do get an answer, the important thing is then you know what the potential complications are, what treatments you can, because really the diagnosis is part of it. What they want then is your access to treatment. And what I think of what these patients are is they're like our family. What would you want for your own family? Coming to terms with a diagnosis, it's like grief. It's because you've lost something, and people struggle. So we do have a psychologist, and sometimes our patients have what we call neuroprogressive conditions, and the condition gets worse and worse, and our treatment is supportive. If I said what one of the best news stories is newborn screening, because early detection is the most important thing for metabolic conditions. So when the baby's born, you do a heel prick, then they're asked to come up here, and the conditions that you're bringing them up for, you can diagnose them, there's a treatment, and they can go on and have healthy lives. 1 in 17 people, it's more common than people, that 1 in 17 people will at some stage in their life will be diagnosed with a rare disease. The most important thing, I think, is that they exist. Early diagnosis, there are treatments, and we want to help you to get those treatments.
So my job as a nurse specialist in metabolic disorders means that I provide care, support and treatment for children across the whole of Northern Ireland who have metabolic inherited conditions. So my day-to-day could be a lot of phone calls. We provide a phone advice line for families, so they can phone us if their child is unwell, and we can provide some medical advice to them over the phone about their emergency care plans. We provide education, so I might be teaching a family on how to take a heel prick for a baby with PKU. We may be out at schools teaching the teachers there about the condition so that they can make sure the child is cared for properly in the school setting. Or I might be administering a drug infusion here in the hospital for treatment of one of our conditions. So some patients are palliative and life limited. Some patients, are on very highly specialised diets, but attend mainstream school and live relatively normal lives as well. So we treat PKU, which would be our main number of patients that we see at our clinic here, children who have a problem breaking down a certain type of protein in their diet. But we also care for a number of children with much more complex medical needs as well. I suppose what I like to say I specialise in is how to help families deal with the diagnosis of a rare condition. So it can be quite lonely and quite scary to be a parent of a child, I'm sure, when maybe nobody else in the country has that condition as well. And they're putting a lot of faith in us.
So our team in Northern Ireland is a regional team, which means then any study days or any training programmes are usually across in either mainland UK or Scotland. With funding issues, we aren't always able to attend any of those conferences or training days. So the opportunity to get funding from Little Heroes would actually expand that. We would be able to kind of link in with other centres across the UK and work closely with them. I also think just for the families and the children, a lot of our families need additional support in the community. They live a very difficult life. They need people to recognise that. So with the likes of, I suppose, equipment or days out for the family or any camps or any funding that they need, a lot of these families, the parents have to be the full-time carers for these children. So I think the Little Heroes will be able to help in their home life as well.
Yeah, so for some of the conditions in particular, diet is the treatment, and that's the only way to manage it. So if they didn't follow their diet, there could be poor outcomes in terms of learning and development. But if they manage their diet and if they follow their advice, then they develop completely normally, and we would just expect the same as any other child. So the diet is a really, really important part of managing their condition. Yeah, so we see children from their babies. We look after the children that get diagnosed with some of the conditions on newborn screening. So we see them from 2 weeks old, and we start off by managing milk, so changing the milk that they have. As the children get older and they move away from having milk and they start to eat and wean and have baby foods, we tell the parents or teach them the best types of foods to have and foods that are going to keep their children well. A charity like Little Heroes could potentially offer opportunities for families to be able to get together. One of the things that we thought about is maybe things like coffee mornings or walks or events. The things that we are going to be asking for through Little Heroes are things that we know are going to directly benefit the families. Having the ability to have the financial help to put stuff like that on and to support with things like that would make a really big difference.
Emily's condition is MPS 1, which is mucopolysaccharidosis type 1, and it's Hurler syndrome. It kind of affects every bit of her body, so at the minute particularly it's her bones and her muscles, which she gets aches and pains most days, and everything from her eyesight to her hearing, her back, yes. When Emily was diagnosed, she was the 7th child in Northern Ireland with it. It was the nursing staff and the doctors that were around us, the reassurance that there was a path ahead and there was treatment and there was things that we could do, and that they were always at the end of the phone if we needed to ask any questions, and always very emotionally supportive.
Caden has a rare genetic condition, it's mitochondrial disease. Yeah, so because it is so rare, he was actually in creche one day and had to ring an ambulance for him, and the ambulance crew didn't even know what they were going to meet, and what is this, you know, and how does it affect him, you know. So it's hard. It does get better. I mean, at the time it was like I thought my world was ending, you know, because it was like, he's my wee boy and this has just been brought upon us, you know. There's a lot of worry, but the hospital staff are amazing, you know, especially if it is like a specialty rare disease. There is people there and they know how to treat the kids, you know, and what to treat them with or whatever it may be. So it has, I know how to manage him now. At the start it was quite worrying, you know, am I doing the right thing? Have I done the right thing? Is he okay? But now, you know, 2.5 years on, I'm like, no, I can do this.